Welcome everyone with your program Pearls of Union, who invade the most successful story and person here in UAE. Today from Dubai City with the Dr. Mehernaz عطائي. This doctor is special here in this country. After 10 years, we need to speak about her experience in UAE. Follow us in Pearls of Union. Welcome everyone with your program Pearls of Union, who invade the most successful story and person here in UAE. Today from Dubai City with Dr. Mehernaz عطائي. Welcome, doctor. So, doctor, can you please introduce yourself for all the person who see us?
Yes, sure. Hi, thanks for inviting me. My name is Mehrnaaz Attoi. I am an ENT, ear, nose, throat, head and neck specialist and surgeon. I have been working, studying, learning and teaching for more than 18 years. I was born in Iran and graduated in Isfahan Medicine University 18 years ago. 10 years I worked in Iran in University Hospital of University and private clinic, and 8 years in Dubai inside the Iranian hospital. I have board certificate of ENT specialty, and I am a member of European Rhinoplasty Society. And I finished postdoctoral courses in advanced functional endoscopic sinus surgery and also endoscopic thyroidectomy, means we'll do it by laparoscope without any scar over the neck. I attend all of the webinars, online webinars and seminars and congresses in the world as I can. And I keep going to upgrade myself, update myself, my knowledge about the new instruments, new medicine and new surgical approaches, actually. I came to Dubai 8 years ago. And I learned trying to be in my best position, to being in my best position, and actually in Dubai. So when I went here, yes, I went through very difficult exams and tough days and hard times, but there is some DHA exams, there is some, it's new environments, and immigration even to the near city, near country also is difficult. But it was a good time, and I'm happy to be here for more than 8 years, and I think I will be here more than this.
I'm very happy to have come here and do my rhinoplasty. It was good. It was okay. It was fast. It was swift. It was very good. I didn't feel any pains or anything. The doctor was very good at it, and I thank you very much for that.
Sure that you have some person from the beginning in your way, they push you and advise you to give you also motivation messages. Who is this person who helped you to
Yeah,
do this?
of course there is. Actually, my parents, both of them are a teacher, and so good teacher also. And also my husband. They are encouraging me, they are supporting me all the time. And of course, my colleagues, friends, family, all of them, I would like to appreciate all of them.
But sure, it's not easy also to do all this one. We speak about the 3 specialty in the same specialty
Yes.
that you choose it. The challenge of work, the challenge of also to coming here to UAE. About this point, the difficult of life, doctor. How can I speak about it?
Actually, 8 years ago when we went here, came here actually, it was a difficult time and I went through difficult exams and hard times and tough days, but it's worthy. Because city of Dubai is very safe, very smart and beautiful city, thanks to Excellency Sheikh Mohammed bin Rashid, of course. And the strategy of the UAE government is to be a hub of medical tourism in the region, and it's very successful, I think. Dubai gets top of rank in medical tourism in the region, as you know, and 6th in the world, and it's a very important point. So the strategy of the Iranian hospital is the same, following the same strategy of the government, and we are trying to be in our best levels of the region about medical tourism. And this is the direction to the future, our direction. We have to following the government of the strategy of the government and strategy of the Iranian hospital. And I think we will be there, hopefully, in soon.
From your experience here in this country, what's your opinion about the technology, the high technology, and to use it in the medical system here in UAE?
Actually, because the city of Dubai is a very smart city, as you know, and there is a very upgrade system in the medical. All of the computers, all of the systems of the patients is connection to each other under DHA. So, and all of the file of the patients inside the computer, inside the HINAI system, and it's categorized as the digitally. So it's easy and hard. Easy because we can access to past history of the patients, access to medicine and medicine that they are using, any history of surgery or history of the disease of the patients, we can easily access to them. And hard because, of course, this will take time to put all things inside the system, but overall it's very excellent system, and I love it, I like it, because it's very helpful for the doctor and for the patients, that very easily to access medicines, and it's direct connection between the patients, between the doctor and to the pharmacy, to the lab or radiology departments, all things only online connections, and no need any paper or prescriptions or something like that. And there is a less mistake, of course, because sometimes it's prescriptions by the hand, of course there is some problems in reading by the pharmacist, and that is some mistakes, and this is avoidable by using this smart system.
Yeah. Doctor, what do you think also about the supporting from the government of UAE, especially Dubai, for all doctors to give him something special like the gold visa?
Yes, I would appreciate too much regarding this golden visa, and it's very helpful for us, and is very encouraging us, supporting us to be more thinking about living more inside Dubai, and don't think about more immigration to other countries. So it's very helpful for us, and I would like to appreciate too much to the Excellency Sheikh Mohammed bin Rashid about that.
چقدر وقت از عملتون گذشته الان؟
الان دقیقاً 9 روزه.
9 روزه. خب تعریف کنیم ببینیم از عملتون راضی هستین نیستین؟
خدا رو شکر خیلی راضی هستم، چون قبل از عمل خیلی اذیت بودم. گوشتم خیلی بزرگ بود و خیلی اذیت بودم، نفسم نمیتونستم بکشم. خدا رو شکر الان بینیم هم خیلی قشنگه و کارتون خیلی خوبه. از شما در نکنم. خیلی راضی هم از کارتون.
Doctor, today you have more than maybe 9 years or 10 years in this country, so you know this upgrade of UAE in the medical system. In your specialty, especially the ENT.
ENT, yes.
This three specialty in the same one.
More than,
yeah, exactly. So we need more details about this specialty, how using the technology, also how update your information about your specialty.
Yes, ENT and head and neck surgery, actually it's not only ear, nose, throat, it's all things, it's a broad variety of the disease and problems in the head and neck. So it's about thyroid glands, it's about salivary glands, about nose problems, throat, vocal cords, is a broad means things. So not only ear, nose, and throat. ENT specialist and surgeon should be do all of the means procedures or surgery or medicine about the medicine, and should update themselves about the new medicine, new technology, new instruments. Every day today, there is new instruments about endoscopic things. For example, endoscopic thyroidectomy is a new technology that we use some laparoscope and without any scar over the face for intraoral, and we can access to the thyroid gland for remove it. And it's scarless without the scar over the face. Or endoscopic sinus surgery also we are doing inside the nose. We approach to the sinus, remove all of the polyps and opening the pathway of the sinuses. And at the same time we can fix deformity of the nose shape and deviated nose and all things. And they are should use instruments, and it means without instruments, without new and good technology, the ENT doctor cannot do anything. So it's very important that progress to the new technology. We need to face the new technology and teach and learn about it and teach to the staff and operations nurses about that. So because of that, every single day we are doing the learning, teaching, studying, and searching about these things. And every year there is some congresses inside the Dubai. Some ENT congresses, maybe every year 2-3 times there is some congresses about ENT. And there is also cadaver dissection, that it's inside the operation. They are teaching practically to the students, to the residents, or to the doctors even, for means continuously improving their skills about the surgery. And also it's very important that as a surgeon you need to learn about communication skills with the patients and relative and others. It should be learned, and Inside these congresses, we are learning a lot. In Dubai, it's very good city for these congresses because every maybe 3-4 months there is one new congress. And during the Corona also, we have online teaching, we have online webinars time to time. And I try to attend all of these webinars in the world, even in India or sometimes Iran also. So yes, it's very important to be continuously improving yourself, your knowledge about all new things, new science, new medicine, new instruments, and new surgical approaches.
About your patient now, what do you think about the difference between the patient here in UAE, the other patient in the other world?
UAE, it's a hub of medical tourism in the region. So all patients, even from Nigeria, we have a lot of patients that it's in the stage of the disease and nobody cannot help them in their country even. So we are visiting every day some patients very difficult in difficult situations. For example, there is thyroid tumors, there is some salivary gland tumors, and very progressive sinus problems that need help from us. So I am doing every day the advanced sinus surgery. We are going inside the nose and in case remove all of the polyps inside the sinus. I had even one cancer of the sinus that I resected the maxilla, means inside the bone. So and sent her to more treatment in governmental hospital regarding radiotherapy or chemotherapy and so on. So in this area, mostly we are visiting some difficult patients. Also, difficult patients regarding even rhinoplasty. For example, they did rhinoplasty in other center and they are not happy. So come here for revision rhinoplasty. And I harvest, for example, rib cartilage or ear cartilage and reconstruct of the nose by some surgery. So, and they are happy. And when I see smiley, happy face of the patients and the relatives, yeah, I realized that's why I'm here. And I went through all difficult exams, tough days and hard times actually. Because after, for example, too many times unsuccessful operation on their face, and specifically in rhinoplasty, everybody can see the face of the patient. After that, when we give them natural nose shape and something, they can breathe by this nose, new nose, and yeah, natural shape. They are happy, and so do I. I'm happy also. So there is also too many other patients coming to us about hearing problem, perforation of the drum, chronic infection, and need help. Some patients only need some advisement. Some patients need only medicine, but some patients need surgery. So I explain all of these options to the patient and relatives, and I make sure that they understand everything and can help me for making a good decision for choose a proper treatment or any surgical approach. So then after that, we are doing with each other, and yeah, most of the times will be successful because the patients and relatives, it's going to me from beginning till the end. And that's it. But here, yes, mostly difficult cases, more than other place, I think, because as I told you, it's a hub of medical tourism in this region.
Exactly. If I ask Dr. Mehernaz about the key of the success.
Working, studying, and being update every single day. You need to learn, teach, means around you, your staff, and also studying, and never ever give up. And I advise to young people that if you want to be a doctor, it's not only a job, it's a kind of your life. So you need to choose this kind of life. You cannot separate your work from your life, so it's same. For example, if the middle of the night your patient needs you, you should be there. Or in the early morning, it doesn't matter what time or when or where you are. So it's a kind of life, and of course it's difficult, but I think it's worth it.
Doctor, if I ask you about your future plan, what do you think for this beautiful future?
Yeah, I think I found my direction to the future because I know that I have to be updated every day. So I want to share my happiness to my patients also, to my family also, and I want to all of my patients in future, like as the past, will be happy with my work, and I think it's very hopefully that I will reach there. And one of the hub of the medical tourisms in the region, and hub of the ENT also, ENT head and neck surgery, medical tourisms in the region, and also in the Middle East and maybe in the world, because I have some patients that came to me from Germany even, and for doing rhinoplasty and some cosmetic surgery, revision or primary cases.
Doctor, we need from your part now a message for UAE, for the government, the person who helped you here in this country.
I would like to appreciate UAE government. I would like to appreciate DHA for helping us, and I would like to appreciate Excellency Sheikh Mohammed bin Rashid for preparing this beautiful, safe, and smart city. And many thanks of you because there is some opportunities that in other cities and other countries we cannot reach them, and it's good opportunity to grow up. Everybody can come here and grow up themselves to be their best doing so. And also I would like to say many thanks to you for coming here and for this nice talk show in Pearls of Union TV program. Thanks a lot.
Thank you so much, Doctor. We are so happy to meet you today. Like a great example of doctor here in
Thank
this
you
country.
so much.
Thank you so much.
Thanks.
Thank you so much, everyone. See you next week with Pearls of Union program. Bye bye.
دبي تعطيك امان.
وظل القياده الرشيده اللي فيها، اللي هي حببت الناس والعالم كله في هالبلد، فانا بالفعل فخور بنفسي وفخور بهالدوله الطيبه.
لبناني.
انا شخصيا ابن مصر.
قيام على البلد ليل مع نهار، تركيزه، ما كنا وصلنا للي وصلنا.
أنا والله عمري 5 سنين وأنا تحت البوش، وهذا يعني اللي ما له ماضي الله يرحم أبوي زايد ما له حاضر.
فاليوم الكل عايش سواء موافد أو مواطن، نحمد الله سبحانه وتعالى أن نحن في أمان وفي استقرار وفي أحلى، يعني وين ما تروح تلقى أنك أنت بين أخوانك وبين أهلك وبين ربعك وبين عشيرتك وبين الجنة.